If you watch the show on a regular basis, you know we're always happy to welcome doctors in the area to come and educate us a little bit. This morning, a topic that many of you may struggle with but feel a little bit uncomfortable talking about. So happy this morning to welcome Dr. Mark Currin, who is a urologist with CHI Memorial Chattanooga Urology Associates. Good to have you.
Good morning. Thanks for having me.
We're talking, we could really have this conversation anytime, but the month of November happens to be a focus on bladder health. So our topic this morning is incontinence. And I'm right, it's an indelicate conversation for people to have.
Most people really don't like talking about this, but we see a lot of patients for this complaint.
I think the good thing is that we might not enjoy talking about it, but we are more aware of the common problem with it because you see commercials all the time advertising different ways to treat it. But you were telling me that there are two different causes, I guess.
Well, so there are three different classifications for incontinence, and one of the most important things when diagnosing incontinence, one of the most important parts about it is determining which type you actually have. Now, there's stress urinary incontinence, which is the type that's associated with when you laugh, cough, sneeze, bend over, or pick something up, strain, things like that, and you leak some urine. And there's another type called urge urinary incontinence, which is where someone may get the strong urge suddenly to get to the toilet and they can't get there in time, so they start to leak urine. And then the third kind is called mixed urinary incontinence, which really has aspects of both.
Okay, so then you were telling me that it's very important if you go to see someone to treat yours that you have an adequate screening, because if you're treating for the wrong type, it's not only not going to work, it can get worse.
That's right. So early on, surgically, when urologists were starting to use surgical techniques with the use of slings to actually support the pelvic floor and the urethra a little bit better to keep people from leaking, those patients who had urge urinary incontinence, actually their leakage would get better, but some of their symptoms would get dramatically worse because they wouldn't be able to empty their bladder as well, and they still had an overactive bladder.
So what do you do in that case now?
So for the treatment of urge urinary incontinence, the first line is medical therapy with medicines that help to relax the bladder. And that it can address multiple different symptoms. One, it can just address the urinary urgency that people complain of all the time. So they find that they don't have as strong an urge to get to the toilet when they do need to go. They have a little more time to get to the toilet, and they go to the bathroom less often during the day.
Okay.
Secondly, it can also help with those episodes of leakage. It can help reduce the number and frequency of those episodes on any given day.
There seems to be kind of a more common approach now to have physical therapy to help in situations like that.
Physical therapy can help a lot with both urge urinary incontinence and stress incontinence as well. I'm sure that any woman who's ever had a baby is familiar with Kegel exercises. Kegel exercises can be used in the management of stress urinary incontinence as well as urge urinary incontinence.
Okay, to that end, this is something that you see more commonly in women than you do men.
The only time we ever really see, I guess the most common time we see urinary incontinence in men is following a prostatectomy where they've had the prostate removed. And that basically can affect the muscles and nerves and the outlet of the bladder, so they have less resistance. And in that situation, men most commonly have stress urinary incontinence, like if they lift something heavy or sneeze or cough, and they have some leakage like that.
These are conversations that we all know it happens. And is it kind of a natural part of aging? You mentioned a woman who's had children. The more children you have, the more likely are you to develop this problem.
It's certainly something that's associated with multiparity or having more children. The more children you have, the greater risk you are at having urinary incontinence. And again, that's more commonly stress urinary incontinence than urge urinary incontinence. But getting older, age is a risk factor for urge urinary incontinence as well, as is obesity.
So, okay, so if you're heavy, that's going to cause more strain, I guess, on your body in general, which creates the problem. So is that sometimes a line of first defense if someone comes to you?
Weight loss, whether it's urge urinary incontinence or stress urinary incontinence, weight loss can dramatically improve those symptoms, and in some situations, people's incontinence can go away entirely if they lose an appropriate amount of weight.
You have two different offices at Urology Associates. You're at the Hickson location. You also have one at the main campus.
Correct.
At Memorial. When someone comes in, do you counsel them as an individual person to find out if they like taking a medication? You'll start that way.
Certainly.
As opposed to a surgical approach?
It all sort of depends. My first decision tree in the management of incontinence is to determine how bothersome incontinence is to a patient, because one person's perception of an acceptable degree of incontinence may be dramatically different from someone else's.
Mm-hmm.
Some people just learn to live with it, and while they may be soaking multiple pads a day, they've learned to live with it to a degree where it's not bothersome anymore to them. And other people would hear them say, I'm not bothered by it, and just be dumbfounded and couldn't possibly understand why. But everyone's different, and everyone takes a different approach to it.
If you develop, okay, two questions. One, for women's sake, if your mother has the problem, is it likely that you're going to develop a problem?
Not necessarily.
Okay.
Not necessarily.
And if you develop a problem in your 30s, and you don't treat it, by the time you're in your 50s, is it going to be worse?
It depends on the cause, and that's a whole nother topic. There's a myriad of different causes for urinary incontinence, whether it's urge or stress urinary incontinence. With regard to the urge urinary incontinence more so than the stress, the bladder is a muscle. Basically, it's a muscle similar to the heart. It fills and it squeezes, and muscles basically are told how to function by nerves that come to and from the brain. So the bladder and the brain are connected, just like everything else in your body, and there's a lot of communication that happens there. And urge urinary incontinence is sort of a way that, it's sort of a situation where the bladder and the brain are not communicating appropriately.
And before I let you go and give folks your contact information, you mentioned the slings. There's a mesh sling, but then there's also something called a native tissue sling.
So there's a synthetic sling that's made out of mesh. And mesh has gotten a lot of really bad press, but in reality, if mesh slings are placed appropriately, they're a spectacular means of treating stress urinary incontinence. But also, if you just don't like the idea of having a foreign body managing your stress incontinence, another thing you can do is you can actually take tissue from your body. It's sort of the lining of the muscle called fascia, and we could take it from the leg or from the belly and create a sling out of that.
Wow.
So you don't have to have a foreign body, and there's some benefits of that compared to slings. The erosion rate, erosion being when a sling could actually erode through your tissues into the urinary tract, which can be very problematic. The erosion rate for native tissue is much lower, the infection rate is much lower, and but the results are similar.
See, he's a great doctor at making the conversation not feel awkward at all. So give his office a call if it's something you're struggling with at all. The phone number you see there is the main campus on Glenwood Drive, 697-0072. But you'll find Dr. Currin at the Hickson location on Hamill Road. That phone number is 541-1125. Thank you so much.
Thanks so much for having me.